BingX, a trusted global crypto exchange. Trade spot, futures, or copy top traders easily. Sign up via the link or referral code to get 30 USDT instantly, plus up to 1,500 USDT in bonuses for verification, deposit, and trading.
New Zealand is experiencing one of its largest public sector strikes in history, as an estimated 100,000 nurses, teachers, and public service staff walked off the job Thursday. Their unified demand: improved funding and resources for essential public services. This widespread industrial action, dubbed the mega strike, saw a diverse coalition of workers unite, with over 60,000 school teachers, 40,000 nurses and salaried medical specialists, and 15,000 public service staff participating. Despite severe weather conditions that necessitated the cancellation of events in Wellington and other areas, tens of thousands demonstrated at rallies nationwide, armed with signs and united in chants. They vociferously called for greater government investment in education and healthcare, emphasizing the critical need to strengthen these foundational community pillars. The urgency behind the strike was palpable, with frontline workers expressing deep concerns about the current state of affairs. Bex Kelsey, a nurse speaking at a rally in Auckland, articulated a powerful sentiment, stating, "Patients should not have to be harmed or die before things improve." She passionately urged the government to invest in the very fabric of our community, not cut the threads that hold it together. Similarly, secondary school teacher Paul Stevens highlighted the exodus of educators from the profession, explaining that teachers are leaving because they have just had enough and they don't feel valued. He emphasized the critical role of politicians in rectifying the situation, demanding that they do their job and to acknowledge the political choices they have made over the success of governments to gradually starve our essential public services of what they need. The decision to strike followed the breakdown of collective bargaining negotiations with the coalition government. While each union presented specific sector-related demands, a common thread of grievances emerged across the board: inadequate pay, dangerously low staffing levels, a severe lack of resources, and deteriorating working conditions that jeopardize the well-being of workers, patients, and children alike. Noreen McCallan, a nurse from Hawke's Bay, shared a stark warning in a statement, expressing fears for patient safety due to overwhelming staff shortages. She described the situation as exhausting for many of us, noting that our patients are suffering longer because we can't get to them as quickly as we should. Liam Rutherford, a teacher in Palmerston North, echoed the call for substantial investment in education, rejecting superficial tinkering around the edges. He pointed out that the government's current offer is insufficient to attract new teachers or retain existing ones, citing the powerful lure of Australia as a significant factor in educators seeking opportunities elsewhere. The pressure on New Zealand's health and education sectors has been mounting for years. Hospitals have been grappling with what have been described as catastrophic failures, stemming from overcapacity, extended waiting times for treatment, and critical staff shortages. Educational institutions are also facing significant staffing deficits. Concurrently, the government has implemented funding cuts to public services, a strategy aimed at economic growth, and has rescinded numerous pay equity claims. This situation is occurring against a backdrop of record numbers of citizens leaving the country, with many seeking better job prospects and higher salaries in Australia, particularly in the education and healthcare fields. The coalition government, however, has adopted a critical stance towards the protest Prime Minister Christopher Luxon has dismissed the strike as politically motivated, with senior ministers for education, health, and public services labeling it unfair, unnecessary and unproductive. Public Service Minister Judith Collins asserted that the government was actively engaged in negotiations with offers, while the unions were out on the street with megaphones, characterizing the strike as a stunt aimed at the government, with thousands of patients and children set to bear the consequences. Despite the disruptions, including the closure of many schools and the reduction of non-essential services in healthcare, public support for the strike appears to be strong. A Talbot Mills poll indicated that 65% of the public backed the action, with nearly half of those who voted for the coalition government also expressing their approval. Opposition parties have voiced their support for the striking workers. Labour leader Chris Hipkins placed responsibility for the industrial action squarely on the Prime Minister, stating that Luxon is out of touch and making our health and education systems worse. He accused the Prime Minister of prioritizing handing out massive pay rises to boardroom directors and millions to tobacco companies, instead of investing in the services we all rely on.